I'm a little surprised I'm even here. We lost power this morning, but good morning to everybody. This is the end of a very busy week. We were filming live every day this week, which has been a very big challenge. And it's almost like I'm starting over with my videos. But this morning we're going to talk about perfection and the stress of it. And we're just going to make it really simple this morning. And that is, I want you to recognize that it's probably one of your biggest stresses, the need to be right or the need to get it right. And it's a very simple idea with a massive influence on your health and a massive impact on your health. So I want to this morning just go over that just a little bit, because when you're somebody like me whose whole life has revolved around health and what's best for you, and I am Dr. Natalie Gonzalez. I'm a retired surgeon, which requires a lot of perfection. And now I do integrative and functional medicine, and I still have the need to get it right. And I think it's been quite a frustration throughout the entire career that I've had of many, many years of trying to get it right and trying to understand what would be the best thing for people. And what I've really understood or come to understand is that in so many ways, we are not going to be able to get it right. For one thing, right changes. For another thing, we just don't have the capacity to really understand how our body works. And so sometimes something you might do will make an impact on your health in some way. And other times you might do the same thing and find that it doesn't do anything for you. Another example of that is giving the same advice to everybody. You give the same advice to everybody, and some people are going to have a really major beneficial impact from that advice, and other people it will fall flat. It won't do anything for them. And sometimes that's a matter of difference in genetics, and sometimes it's also a matter of difference in the rest of the environment of that person that's going into making them healthy or not healthy. And a perfect example of that for me was just doing all of the things that I could to eat the right things and even start to exercise more, things like that, and then find that they weren't making any difference for me. And a lot of times what I was doing was unraveling everything with my stress and my lack of sleep. And you can do all the things, you know, that you think are right, but if you're unraveling it with your stress and you don't even understand how you're doing that, everything that we think goes into making a certain emotion in our body, and that certain emotion carries certain chemicals. So a certain chemical brew of molecules in our body, and those things circulate to all our cells and determine whether we are going to get cells that are functioning well or not functioning well. So if you're listening to this and you have questions, or you have felt this way in the past, that you are doing everything right, but it's not making a difference in your health the way you want it, just take a little, give us a little comment there, or answer the poll and tell us if you've ever had problems like this. We're going to start this week. I want to put some polls on our live session so that people can tell me what they're thinking or how things are going for them. And I'm also always going to have the comments section open, so you're welcome to put a comment in there of something you tried that didn't work. Maybe you tried really hard at it and spent a lot of time and years at it even, and it didn't seem to make a difference. And one of the examples for me this past week was gut health. I've worked at gut health for years for myself, And it was only in the past, 6 months or so that started to change. And I've been doing whole food, plant-based diet for the last 9 months, and I think that might be what started to help my gut start to change, even with all the other things I was doing. So I really do know of lots of cases where we will attempt to impact somebody's health. And in medicine, this happened a lot of times to me, where I would use what we were taught was the best thing to use in a particular situation for a person, and have that person say, that didn't do what you said it was going to do. I had this side effect from it. And I would think, oh, that's impossible. From all the research and everything out there, there's nothing that says that it causes that side effect. And then years later, I would find out that that very side effect that they had was actually becoming more well known. And a lot of people were having that side effect, or people with a genetic disorder of a certain type, a genetic variation, I should say, not disorder, but a genetic variation would have that side effect. And so, as a physician, I really had to step back and recognize that nothing is absolute. And if somebody tells me that they're having a side effect from something, I really have to listen to them, because we in medicine simply don't know everything. Of course we don't. We like to think we do sometimes, but I think that's a big fallacy. And the people who are practicing medicine need to really recognize that we have so many holes in our knowledge, and we will for years, because the complexity of the body and the body interacting with the environment is beyond our ability to really understand completely. I think it's fascinating, actually. So from the standpoint of stress, let's go back to that for a second. Stress and having to be right. And I think we need to just be able to step back and understand what that need to be right and the impact that it makes on our body all the time, and see if you can let go of it sometimes. Letting go of it, sometimes it just takes such a weight off your shoulders if you are at an impasse with somebody and they're saying something and you have an opposite opinion of it, rather than just get so attached to your opinion. See what you can do to either see it from their point of view, which is very hard sometimes, but even just to inject the possibility that there might be another way to think, or there might be another answer. And it doesn't necessarily have to be yours or theirs. It could be just another answer that nobody can see yet. So giving yourself that room to be wrong, or and not let's see, giving yourself the room to be wrong and to be okay with not knowing. Just be okay with not knowing. And that is a tough thing to do, but it's a very, very freeing thing to do. I know when I'm able to do that, to step back and just look from afar and look how much I need to feel like I'm right, and how tightly I'm holding on to that need, and just step away from it and observe it a little without any judgment, just to observe it. This is a big, big step for us as human beings, and for our mental and physical health, since our physical health is so related to how we're thinking, and so related to that degree to which we hold tight onto that, that need to not be wrong, the need to be perfect, the need to have all the answers, and just be okay with not knowing. So that's maybe a big thing this morning. I have worked at this for a lot of years. It has changed over and over throughout my medical practice, and each year we come out with new information, different studies, different research. We have to kind of reevaluate and figure out how to give people new information based on this new research. And it's just a constantly changing thing. And I think for myself, just being okay with that. In the beginning, you know, things that I did that I thought were the healthiest for me, like drinking a lot of milk and things like eating a lot of eggs and maybe not eating fruit and things like that. I've completely changed my my understanding of those things has completely changed over the last few years. And I think it will continue to evolve. It just will. I think that's what this is all about. You need to be okay with it, or you'll just end up giving yourself a whole slew of chemicals in your body that will break down things that you're trying to renew and regenerate. So get out there, get lots of sleep, deep, restful, restorative sleep. And if you're having trouble with that, then look a little further and see if your stress is underlying your inability to sleep, and your need to get it perfect or be right is underlying your stress. This is Natalie Gonzalez, Dr. Natalie Gonzalez of Synergy Health and Wellness, completing our first week of live sessions. We're going to go into the second week, and I will be telling you on Monday, Sunday or Monday, tomorrow's Sunday, but I will be telling you in the next day or so that we're probably going to start to do a certain type of talk for 10 or 15 minutes each morning, and I'll tell you what is going to be occurring on each day. So Monday, it might be, maybe we're going to talk about a food. Maybe on Wednesday, we're going to talk about a particular health hack, just things like that. So we'll get into a routine and a schedule, and I'll let you know for sure what that's going to look like in this next week or two as we practice it a little. This week I had to learn how to, like I say, I'm starting all over this week. This week I learned how to not film sideways or upside down. I learned how to turn the camera on. I learned how, for some reason, when I go private, I get a lot more views and a lot more subscribers. And when I go public, I get pretty much 0. This week, I want to learn how to put the link out there for people of the live sessions so that maybe they can plan a little bit more and maybe share that link with somebody else that they know who might need some of this information. So lots of different changes we'll have this week. I want you to go out and just observe yourself a little in these next few days and see how you feel, and see if you can observe yourself needing to be right or getting it perfect, and then see if you can even go a step further and be okay with not being perfect or right. All right. Take care. We'll see you in the next live video, 11 o'clock a.m. Mountain Time tomorrow. Have a great next couple of days for your weekend.